Over the years, I've been involved in a number of disaster exercises and drills, and a lot of times what will happen is like a community hospital will identify a space. It could be a high school gymnasium, it could be a community center where they're going to reposition to that if the hospital infrastructure has been impacted. And on exercise, we've noticed that community hospitals will move an emergency department, or in some cases an ICU, to these buildings of opportunity, and they might move larger M tanks or K cylinders, K tanks, into these areas. But on exercise, you start getting into oxygen duration calculations, and you're talking to the hospitals, and you quickly realize that you have somebody on a ventilator, you might only be able to ventilate them for a few hours. And so your actual capability is quite limited, even in a well-resourced area. And so part of the use case scenario is to redeploy that asset into a building of opportunity. In 2021, July of 2021, Ornge worked very closely with our provincial disaster team, EMAT, and we actually operationally deployed 2 MOVES SLC systems for surge capacity into a remote community, Keshechewan, to provide surge support. Part of that surge planning was recreating some medical infrastructure in either buildings of opportunity, or in this case it was more tent infrastructure. And so the use case scenario there, while the major portion of the operation was providing primary care support, evaluation, and the operational plan was to medically evacuate patients before we had to resuscitate the patient. Sometimes, due to weather conditions, we may not be able to get an aircraft into some of these communities for 2 or 3 days because because the ceilings are too low. And so we pre-positioned MOVES SLC systems for a few reasons. One, if the weather tapped out on us, and 2, if we had to resuscitate a patient, which would require us doing a rapid sequence intubation, intubating them, and then putting them on a vent. And so sometimes there's delays in just medically evacuating patients. That's an example where we actually operationally deployed the MOVES SLC system as a bit of a mitigation strategy. It gave us a high degree of confidence that if we had to resuscitate a patient, we had a device available for us to be able to do that.